Good afternoon and welcome to the Colorado Health Foundation's Advocating for the Consumer in Health Coverage Funding Opportunity webinar. My name is Beth Clemens and I'm the Events Manager here at the Foundation as well as your chairperson for today's webinar. Let's go ahead and get started with some housekeeping notes. Our webinar today is being recorded so that others who could not attend can watch the presentation later. Tomorrow you will receive a link to this recording as well as the PDF presentation that we'll go over today. We'll also post the recording and the presentation on our website at www.coloradohealth.org. In order to minimize background noise, your phones will be muted in a listen-only mode during the presentation. The final portion of our webinar is devoted to questions, so please feel free to send your questions via the chat function at any time during the presentation. You should see a chat dialog area located on the lower left-hand side of your screen where you may type and send questions. You will also see a raise hand button, which we will not be using, so you don't need to click it when asking a question. If you have any technical difficulties during the webinar, please call ReadyTalk's toll-free technical support number at 1-800-843-9166. Make sure to have your registration confirmation available. Finally, after today's webinar is concluded, you will have the opportunity to give us feedback through a short survey. We ask you to take a minute and complete the survey, which helps us improve our future presentations. And with that, I'll turn the conference over to Amy Latham, Portfolio Director for Healthcare and Health Coverage at the Colorado Health Foundation.
Right.
Amy?
Thanks, Beth. Good afternoon, everybody. As Beth mentioned, I'm Amy Latham, the Portfolio Director for Healthcare and Health Coverage here at the Foundation. I actually had a chance to look over the registration list for today's webinar prior to the call and was thrilled to see so many familiar faces, or familiar names among the participants, as well as some new folks that I haven't yet had the chance to meet. I thank you all for being with us this afternoon. I'm just going to provide some brief introductory remarks just to provide a little bit of context for this new consumer advocacy initiative that we'll be introducing this afternoon. I'll then turn it over to Erica Snow for a detailed overview of the initiative, including the application process, timelines, criteria for funding, etc. Next, Kelsey Price will discuss our evaluation approach with this initiative. And finally, as Beth mentioned at the end, we will take some time to answer any questions you might have. Of course, should you have any questions that come up after today's webinar, please don't hesitate to reach out by phone or by email. We'll be sharing some contact information with you later on in the webinar, and you can also find all of our contact information on the Foundation's website. So to get started, I thought I would just provide a little bit of background. Many of you may be aware that earlier this year, the Colorado Health Foundation announced refined goals and strategies in each of our three outcome areas: healthy living, health coverage, and health care. These refined goals are listed here on this slide, and of course more information about them is also available on our website, including an archived copy of a webinar that we did earlier this year, really reviewing in detail our strategy refresh process and the refined goals and strategies. Briefly, our healthy living goal is that all Colorado kids are fit and healthy. Our health coverage goal is that all Coloradans achieve stable, affordable, and adequate health coverage. And finally, our health care goal is that all Coloradans achieve health with support from a network of primary health care and community services. As you will see on this slide, we've also established numeric goals for each of these outcome areas to really help galvanize our energy and crystallize what we hope to accomplish. In coverage, our galvanizing target is that by 2023, 95% of Coloradans will have health coverage, and the percentage of underinsured in Colorado will be reduced to 4%. In addition to announcing these refined goals and strategies, we're also refining our grant-making approach. We're taking a more tailored approach to our grant making. Grants will be made from program areas within each strategy moving forward, and within a program area we will have specific funding opportunities such as the one that we are announcing today. So as I mentioned, the Colorado Health Foundation's health coverage goal is that all Coloradans achieve stable, affordable, and adequate health coverage. Within this goal we have two strategies. Our first strategy is to support Coloradans in choosing, using, and maintaining adequate health coverage. Our second strategy is to address healthcare costs and affordability so that the coverage expansions are sustained over time. The consumer advocacy funding opportunity we're about to hear about is really aligned with both of these strategies. So why are we launching this initiative now? So there are several important internal and external changes that really make this particular initiative very timely for us. In 2011, the Colorado Health Foundation sold its stake in the HCA Health One joint venture. As a result, the foundation anticipates that it will transition to private foundation status in 2016. As a private foundation, we will no longer be able to earmark grant funds for lobbying purposes. In 2013, many of you are probably aware, the Colorado Health Foundation created and seed-funded an independent 501c4 advocacy organization with a mission to increase Coloradans' access to health coverage, quality health care, and healthy living through changes in public policy. This new organization presents a tremendous opportunity for health advocacy in Colorado, and we are really excited at the potential for new partnerships that it creates. And finally, and certainly something that each and every one of you on the call today is very aware of, the healthcare environment has changed and continues to change very dramatically in light of recent state reforms and the implementation of the Affordable Care Act. For these reasons, we saw an opportunity to assess and to revise our approach for supporting the critical work of consumer advocacy organizations. We are tremendously excited about this new funding opportunity. And before I turn it over to Erica Snow, who led the development of the initiative, for a detailed overview, I wanted just to take a moment to thank all of you on today's call who have provided us input, ideas, and feedback along the way. Whether through the scenario planning process that we did or through one-on-one conversations, it's all been incredibly valuable to us in really shaping this initiative, and I'm really excited about where we're headed. So with that, I'm going to turn it over to Erica.
Thank you, Amy. I too am excited to present our funding opportunity to you today. We have been working diligently on its development since the fall of 2013. Last September, we commissioned Julia Lin with Spark Policy Institute, along with Tanya Beer and Pilar Stella, to assist us with both the research and planning phases of the funding opportunity. They brought deep expertise in facilitation, evaluation, and most importantly, provided a new framework in helping our foundation move towards being more adaptive and supportive of advocates in a constantly changing environment. Over the course of 8 months, they led foundation staff through a thorough literature review, engaged national and state policy funders, and convened key stakeholders throughout the state of Colorado in 6 scenario planning focus groups. The scenario planning, a key component to the development of this funding opportunity, is a process of surfacing several possible futures and then exploring their implications for strategy. The Foundation's process engaged more than 40 advocates across the state, including health providers, community organizers, local health alliances, rural health advocates, under the DOME advocacy organizations, and consumer advocates. I suspect some of you are participating in today's webinar, and again, we thank you for your participation in the scenario process. I will now present you with our end product, and again, we are hopeful that this new funding approach resonates with the input that everyone provided. Our goal for the funding opportunity is to ensure that public policy adequately addresses consumers' needs regarding health insurance, access, and affordability. In addition, we have a network target that Colorado has an effective field of consumer advocates and consumers proactively influencing public policy decisions regarding health coverage and the cost of care. As part of the scenario planning process, advocates across many different interests identified a set of policy priorities, strategies, tactics, and voices as both relevant and critical regardless of which political scenario is unfolding. The following targets are representative of those policy areas that surfaced as critical. These targets will guide the criteria for our funding and policy work within this funding opportunity. They include policies that support building the public's health care and health insurance literacy, including their understanding of how to use their insurance to access preventive care and improve their health outcomes. Policies that support decreasing health care costs without decreasing the quality of care, including increased transparency around costs. Supporting convergence across payer sources and provider networks around models for effective payment, and delivery reform to reduce costs and improve outcomes. And finally, protection of policy and budgetary successes from the past few years, including but not limited to the Medicaid expansion, the Essential Health Benefits requirement, and Connect for Health Colorado. So how will we go about achieving our goal and addressing the policy targets? This slide provides a visual of the funding opportunity. And at its core are the advocacy strategy and learning convenings. These biannual convenings will be crucial in providing guidance to our internal coverage team to include guiding future advocacy grant criteria and the Foundation's policy efforts, specifically the responsibilities and activities of our policy staff in the area of health coverage. In addition, it will be a key component of our evaluation process, which Kelsey Price will elaborate on later in today's webinar. Again, the advocacy, strategy, and learning convenings will be held biannually, November and May, pre and post legislative session. While the convenings are strategically scheduled around the legislative sessions, it is important to note that the legislative session is not its only focus. Rather, the convenings will focus on reflections and potential adaptations to the policy targets that I outlined earlier, and contribution to and review of the evaluation findings. Moreover, the convenings will be a forum to identify the current policy scenario and its implications for effective advocacy, to include what advocacy strategies should be deployed in the coming months. Again, this will then drive future grant criteria as well as future activities for our policy staff in the area of health coverage. Now I will focus on the grant-making portion of the funding opportunity. The opportunity has three buckets of funding. General operating, which is the grant opportunity open to applicants this October 15th, as well as program grants to be made available starting in June 15th, and rapid response grants that will be available post our first November strategy and learning convening in 2014. General operating grants will be available both this October 15th and again in October of 2016. Applicants can request 2 years of funding. Applications should be submitted through our standard grant application, but applicants will also need to include an attachment made available on the funding opportunity webpage. There will be a 25% cap on funding based on overall operating costs. We are happy to talk with individuals offline about what this means for their organization, particularly for those organizations who may have advocacy goals broader than just health coverage. And finally, general operating grantees will be required to participate in the biannual advocacy strategy and learning convenings. To be eligible for general operating grants, we are looking to fund those health advocacy organizations that represent consumer interests and actively engage the consumer voice. Further, we want to support those organizations whose priorities focus on one or more of the following: reducing healthcare costs while maintaining quality and increasing transparency, building the public's healthcare and health insurance literacy, supporting a healthy and competitive health insurance marketplace, and supporting effective models for payment and delivery reform. Competitive applicants will have established strengths in messaging, public will building, coalition building, and advocacy skill building, including deepening the bench of advocates. They should have experience engaging new and a diversity of voices in advocating for the policy priorities I outlined earlier, as well as a focus on equitable implementation of reform and coverage improvements that are representative of the consumer's interests. And finally, they should have a strong track record of success. As I noted earlier, we will also have program grants available starting in June of 2015 and then annually through June of 2018. Grants can be 1 or 2 year requests. There will be a project-dependent $100,000 cap on each program grant. We anticipate funding up to 4 program grants annually. The criteria for the program grants will be determined following the November Advocacy Strategy and Learning Convening. Again, these convenings will drive the development of the criteria for both the rapid response grants, which I'll describe shortly, and the program grants. We anticipate that these grants will be available to both existing grantees and non-grantees. This portion of the funding opportunity, specifically the program grants announcement, will be on our website in April of 2015, so stay tuned. Alas, our rapid response grants. These are smaller grant opportunities available on a rolling basis with a shortened application process. We hope to turn around these grants in 2 weeks. The criteria of these grants will also be determined in the November and May Advocacy Strategy and Learning convenings. They will only be open to existing grantees to include those receiving general operating and/or program grants. These grants will likely be solicited following each convening beginning this December of 2015. So this concludes the grant-making portion of the funding opportunity. If you think you may be eligible for one or more of these grant opportunities in the future, please contact me. My email here at the Foundation is esnow@coloradohealth.org. We encourage all potential applicants to speak with a program officer prior to applying. So now I'm going to turn it over to Kelsey Price, Director of Evaluation, so she can walk you through our new evaluation approach under this funding opportunity.
Thank you so much, Erica. So as many of you know, the Foundation has been changing its approach to evaluation over the last year. And in the past, we haven't necessarily had a great way to understand the advocacy work that we have been funding. And we recognize that advocacy happens in a very emergent space. It's constantly evolving and adapting, and it's not the type of work that can be easily translated into a quantitative metric in many cases. So as part of the development of this funding opportunity, we worked with our partners at Spark Policy Institute to develop a framework that would really help us understand how our advocacy investments are helping to make progress towards our policy targets. So today I wanted to give you an overview of what this will look like and what it will mean for grantees who come in under this particular funding opportunity. So the evaluation of this funding opportunity has multiple purposes. It has some elements that are a little bit more related to accountability and other elements that focus on really providing real-time data to help both our partners and ourselves make decisions in the constantly changing world of advocacy. The evaluation will be conducted by an external evaluation group, and the Foundation will be identifying our evaluation partner prior to the first advocacy learning convening in November. The goal of our evaluation approach is to really understand the progress that our grantees are making towards their goals and how they accomplish this progress. To help us understand this, we will be asking all grantees under this funding opportunity to engage in yearly reporting. But if you've been a grantee of ours before, the reporting probably won't look quite the same. Our evaluation partner will be helping us to develop some customized reporting that will really focus on asking grantees to reflect on the activities that they've engaged in across the course of the year and how successfully they feel these have helped them to move towards the policy targets that they were seeking to impact. A major focus of the evaluation, however, will be on understanding the changes taking place in the policy environment, how advocates are thinking about negotiating these, and whether we are all making progress towards the policy targets that Erica talked about earlier. Our evaluation partner will be regularly collecting data throughout the year, and most of that will be qualitative data that would be gathered through interviews with key stakeholders among our advocates and among other stakeholders in the community. The focus of that data is to really help the Foundation and our advocacy partners understand what the policy environment is looking like, what scenarios are unfolding, where are possible leverage points. This kind of information will help both the Foundation and our partners make decisions about the most impactful goals to pursue and what kind of tactics might be most appropriate for the current environment. This data will also help us regularly assess the progress that we're making towards achieving the policy targets that have been outlined in the funding opportunity. The data that's being gathered by our evaluation partner will be used, as Erica mentioned, as a real basis of conversations in the strategy and learning convenings to inform the conversations and decisions about how to approach the work. And the convenings will also serve as a point for us to learn with our partners about their perceptions of the current advocacy environment, the activities that they're undertaking, and the successes and challenges that they're encountering in their work. So as you can see, the evaluation is really central to the design of this particular funding opportunity. it is designed to provide very actionable, real-time data to inform the decisions of both the Foundation and our advocacy partners, and to simultaneously assess the progress that we're making towards the policy targets that were outlined. We at the Foundation are really excited about this new approach to evaluation, and we really look forward to engaging with our advocacy partners in this very new and different way of engaging with you when it comes to evaluation. So I will turn it back over to Beth to answer questions.
Thanks, Kelsey. So we'll go ahead and start the Q&A portion of the webinar. And just a reminder, if you have a question, you can go ahead and type that in the chat dialog area that's located on the lower left-hand side of your screen. So the first question is, can you address funding for lobbying activities, specifically whether that's permitted?
Hi, this is Cassidy Smith, Senior Policy Officer with the Foundation. And the Colorado Health Foundation supports advocacy work. The term advocacy encompasses a broad range of activities that can influence public policy. The Foundation will no longer be earmarking grant funds to be used for lobbying.
Great. Thanks, Cassidy. Another question, my organization's advocacy work is not focused on representing consumer interests or engaging consumer voices and advocacy. Should I still apply?
This is Erica Snow. The general operating grants under this initiative are specifically for organizations representing consumer interests or engaging consumers in advocacy. So if you're a membership organization representing healthcare providers or representing other interests, this grant opportunity is probably not a good fit. However, program grants and rapid response grants will prioritize organizations representing consumer interests, but will also consider grants from other organizations. So please stay tuned.
Thanks, Erica. The next question, who will be able to attend the twice yearly convenings? Is it just grantees, or will they be open to others as well?
Great question. Again, this is Erica Snow. The convenings will certainly be a requirement for grantees, but are also open to other advocacy organizations as well as health funders in the policy arena. And we do want a large representation, so if you have an interest in attending one or more of the convenings annually, please contact me and I'll get you the information you need to get registered.
Great. And another question related to the convenings, what is the agenda for those two convenings?
Great question. Every convening will include a combination of sharing what has been learned about the policy environment, exploring with advocates which scenarios are unfolding, and the implications for advocacy, and discussing the results of this exploration with health policy funders in Colorado. Every convening will include an opportunity for feedback from advocates so that the approach can be improved over time.
Terrific. The next question, will there be advocacy funding opportunities available in the Foundation's other program areas, for example, healthy living?
Hi, this is Amy, and I'll take that question. It's a great one. Our advocacy is critically important, really, to all of our work here at the Foundation. There are not any specific advocacy funding opportunities in development in the other outcome areas at this point in time, but I anticipate that over time we will see advocacy either as a part of other funding opportunities or as standalone funding opportunities in the future. So I would say stay tuned. If you are not already signed up for the Foundation's emails, please do so that you can get notification of funding opportunities as they become available.
Thanks, Amy. Just a reminder, if you do have a question to ask, go ahead and type that in the chat dialog box on the left-hand side of your screen. The next question is, we have another grant from the Foundation. Will that preclude us from applying for this funding opportunity?
This is Erica Snow, and I'll take this one. You certainly may apply for this funding opportunity regardless of whether you have another grant from the Foundation. But just a reminder, the cap, the 25% cap requirement that I noted earlier will be applicable under this funding opportunity. So again, we are looking at funding no more than 25% of an organization's overall general operating.
Great, thank you. So seeing no more questions, I think that concludes our question and answer period for this webinar. Just a reminder, if you do have a specific question that you want to ask Erica, you can contact her directdirectly, and her email address is esnow@coloradohealth.org. And as I was saying that, we actually just had one more question come in, so we'll go ahead and take that. The question is, you said you would fund up to 4 program grants annually. Was that total or per applicant?
It's a great question. At this time, we don't have a conclusive answer for you because we're not quite sure what the criteria will look like. But broadly, we don't anticipate funding more than $100,000 per program grant, and that is somewhat project dependent. And then given that funding cap at $100,000, we don't anticipate funding more than 4 per year. And it's unlikely that we would be funding several to just one organization. We anticipate that will go to a number of community-based organizations in the area of health and consumer advocacy.
Thanks, Erica. And thank you to all of our participants today. Hopefully we were able to answer all of your questions. Tomorrow you will receive an email with a link to the webinar recording as well as to a PDF of the presentation from today. Don't forget to complete the short survey that will be available on your screen after we end the webinar. Your feedback will help us to improve our future presentations. Thanks again for joining us. Have a good day.